Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi, that's from 7:30 to 8:30, and we have an international session from 8:30 to 9:30, and from 9:30 to 10:30, we have local language session in Malayalam. All these sessions are going in a good way. We are able to upload the videos on the very next day or the day after the session, so that those who miss the session can watch it again, and you can share as well as subscribe the same with your friends and colleagues, so that homeopathy will reach every corner of the world. That's the purpose of our forum, and we have doctors and eminent personalities from international session, that is from 65 countries have presented various sessions here, and all the presentations were brilliant, and they have talked about different subjects. Today, our guest is Dr. Suneera Abdul Jawad from Qatar. And she has completed a BHMS in homeopathy and MD in acupuncture. And Dr. Suneera is currently working in the medical insurance department in Family Medical Clinic, Qatar. She is a YouTube content creator, uploaded various health-related videos on her channel. Dr. Suneera has completed medical coding, done certification on UK Safe Handling Medicine Foundation and social care. Earlier, worked as a homeopathic doctor in Cure Plus Homeopathic Clinic and RM Homeopathic Clinic in Malappuram, Kerala. So she's a very dynamic junior doctor. She has her own practice in the early part, but now she is practicing in UK, in Qatar. And as usual, there's a different subject to be talked here: insomnia and homeopathic management. As you all of us know, that insomnia is a condition where people find it very, very difficult to manage the situation. They are taking a lot of medicine from the other side, but still they are struggling to get the sleep, exact sleep. So in those conditions, homeopathy can do wonders. So let us hear what Dr. Suneera Jawad has to say. We proudly welcome a dynamic young doctor to this profession, and from this profession to talk on this evening. Welcome, doctor.
Hi, everyone. Am I audible?
Yes, yes.
Okay. Hi, everyone. It's me, Dr. Suneera. First of all, I'm extremely grateful to the IFPH team coordinator for giving me this amazing opportunity. The topic what I'm going to deal today is insomnia and homeopathic management. As you all know, insomnia is a sleep disorder where a person has difficulty falling or staying asleep. So before going in detail with insomnia, let's see what's a good sleep. A quality of sleep means you're getting uninterrupted and a refreshing sleep. Getting quality sleep, it's not just of how many hours you're sleeping, but how well you sleep and how energetic you wake up the next morning. Next, the key characteristic of good sleep. First of all, adequate duration, sleep quality, uninterrupted sleep, falling asleep easily, feeling refreshed upon waking. First, let's check what is adequate duration. The amount of sleep, it varies regarding the ages. For adults, it's recommends 7 to 9 hours of sleep per night. Then sleep quality. A sleep involves moving through all necessary sleep cycle, including light sleep, deep sleep, and REM sleep. Deep sleep helps in the physical restoration, and REM sleep is crucial for cognitive function, memory, and emotional regulation. The physical restoration, it helps in the aid for the natural healing process of the body. And REM sleep is crucial for the cognitive function. For example, like thinking, reasoning, problem solving, decision making, so on. Then uninterrupted sleep. A good sleep is typically uninterrupted, allowing you progress smoothly through all the stages, as we said, like the stages like light sleep, deep sleep, and REM sleep. That's the rapid eye movement sleep. Next, falling asleep easily. A good sleep starts with falling asleep relatively easily, about 15 to 20 minutes of going to bed. Next, feeling refreshed upon waking. A good sleep leaves you feeling rested and alert when you wake up. You should feel ready to start your day without any fatigue. For example, if in the night if you're not feeling sleepy and you spend a lot of time without sleeplessness, next day you'll be feeling completely tired and you will be having poor concentration and even total fatigueness. Next, the age group and the recommended amount of sleep. For infants 4 months to 12 months, it's recommended 12 to 16 hours per 24 hours, including the naps. Then 1 to 2 years, 11 to 14 hours per 24 hours, including the naps. Then 3 to 5 years, 10 to 13 hours per 24 hours, including naps. 6 to 12 years, 9 to 12 hours per 24 hours. Then for 13 to 18 years, especially for the teenagers, they have to sleep 8 to 10 hours per 24 hours. Then adults, 7 hours to 9 hours. Next, let's check the types of insomnia. According to the duration, insomnia is classified into three: transient, acute, and chronic. Transient is less than a week. If it's persisting for less than a week, it comes the transient insomnia. And if it's persisting less than a month, it comes the acute insomnia. And if it's persisting more than a month, it goes to chronic insomnia. Next, let's check what is transient insomnia. As we all say, transient insomnia, it persists for less than a week. Transient insomnia refers to a short-term temporary difficulty with sleeplessness, typically lasts for few days and is caused by external factors like stress, anxiety, and change in the routine or disruption in the environment. For example, if you are having a noisy environment, you'll be not able to sleep, and even some sort of anxiety or stress. So in this case of transient insomnia, you don't have to go for any medication, just and the underlying cause is addressed. If the underlying cause is removed, you will be able to sleep well. So in this case, no medication is recommended. Next, some common triggers. Let's see it's again for transient insomnia. First of all, stressful event. For example, work pressure and personal issues. Especially this is be affected by the those who are going for work. They'll be having a monthly target and end date. So they'll be having some sort of tension. So in this case, they'll be feeling sleeplessness. So in this case also, you don't have no need to go for any medication. Once you achieve your aim, achieve your goal, you'll be feeling ability to sleep. Next, temporary discomfort. For example, illness or noisy surrounding. If you're having mild fever or cough, it will disrupt your sleep. Then noisy surroundings. If you're surrounded, that's the environmental factors. If there is from your neighborhood, if there is some noise of any work going on, you will be not able to sleep that night. Next, in most cases, improving sleep hygiene and addressing the underlying cause can help resolve transient insomnia. Here, it's mentioning the sleep hygiene. Sleep hygiene, it can be both environmental as well as behavior. So behavioral means it comes like if you're not following a consistent sleep routine. And environment, as we already discussed, like the noisy surroundings, and if there is an untidy room and all, you will be not feeling like to sleep. Next, acute insomnia. Acute insomnia is a short-term insomnia. Acute insomnia typically lasts for few days to few weeks, often triggered by stress or traumatic event and major life, moving or job loss or death of loved ones. So in case of death of loved ones and all, you will be not able to sleep for some days. Maybe it will be persisting for a month and all. Then difficulty falling asleep is the main symptom of staying asleep, but the problem resolved once the stressor is removed. In case of acute insomnia also, you don't have to go for any medication. Maybe after removing the causative factor, you will be able to sleep well. Next is chronic insomnia. Chronic insomnia is a condition where a person has difficulty falling asleep or staying asleep for a prolonged period, typically 3 times per week, at least 3 months. It has various causes like physical and emotional well-being. Next comes the causes. Let's see. First is psychological factor like stress, anxiety, depression, trauma, it will interfere with your sleep. Then the medical condition, for example, chronic pain, sleep apnea, restless leg syndrome, gastrointestinal issues, or other health condition. For example, sleep apnea, we know that sleep apnea is a uh, difficulty in sleeping due to breath difficulty. So in this time, patient will be feeling a sudden pause of breathing. It persists for few seconds to few minutes. Then restless leg syndrome, as we all know, restless leg syndrome is a neurological disorder where there will be an overwhelming impulse to move the leg. The patient will be feeling some sort of sensation like tingling or aching, and the patient will be moving his or her leg. So this will also can lead to insomnia. Next, medical conditions. Medications. Some medications, for example, those who are having high BP medication, for example, like BP medicine or asthma medicine or depression medicine, it can disrupt the sleep. For BP medicine, especially, there will be beta blockers. So, what it's assumed that these beta blockers can interfere with the sleep producing hormone. So in that way, when those who are having BP medicine regularly, they'll be having insomnia, that's sleeplessness. Next is lifestyle factors. First of all, poor sleep hygiene, irregular sleep schedule, and taking of caffeine, alcohol consumption, or heavy use of electronics. So poor sleep hygiene, as I already said, there will be both environmental and behavior. Because like if your room is not tidy or if it's too much mess and like if you're having like not following a proper routine for sleeping, it will disrupt your sleep. And next is caffeine. Caffeine can also cause insomnia. That's why it's always better to take, especially coffee and or just take it morning. Better to avoid during evening because the caffeine content it can interrupt with your sleep. Then the heavy use of electronics. Nowadays we all are too much addicted to the electronic use, like especially phone. The blue light that is emitting from the phone it can cause sleeplessness because it suppresses the production of melatonin, which is the sleep hormone. Even not only it disturbs the sleep, nowadays most of us are having the habit of scrolling in Instagram as well as in YouTube and all. So at this time we are continuously scrolling. It's causing a fatigueness to our eyes and even to our brain also. Because the more we scroll, the brain spends more energy to capture the news. Even what happens means while sleeping, if you're just taking your phone and watching the any stories or a YouTube content and all, which sometimes many horror or sad content, it will interfere with our mind and we'll be feeling those some sort of disturbance. Even if you sleep also, you'll be feeling some sort of fear and all from this content. Next comes the other types of insomnia. Now we discussed about transient, acute and chronic. Now the other classification is one is behavioral insomnia of childhood. This typically affects children and can last until the child learns better sleep habits. Causes poor sleep habits such as irregular sleep schedules or association with sleep aids. That means the kid always need a parent to fall asleep. Symptoms, difficulty falling asleep or staying asleep are often related to learning behavior. So it's always better to train our children from the early childhood because nowadays even adults and even children also they are not having proper sleep, maybe due to any addiction like social media and all. This even in the early childhood, if the baby is not sleeping properly, it will not only affect the baby as well as the mother. So always better to train your baby or children just from the early childhood itself, then it will be easy for them to follow it in adulthood. Next is primary insomnia. It can be either short term or long term. Causes not linked to any other medical or psychological condition, often result of a stress or environmental factors such as noise or light. For example, trouble falling or staying asleep, feeling tired during day and poor sleep quality. So primary insomnia, it's not due to any underlying condition, it's just due to the environmental factors or stress. Next comes the secondary insomnia. Secondary insomnia, it's due to any underlying causes. It can be last for a variable length of time. This type of insomnia is caused by another condition such as depression, anxiety, or chronic pain, asthma, or any other medical issues. As we already discussed, we discussed about the blood, those who are having high BP, maybe they'll be having some sort of disturbance, even like if they're having any chronic pain, it will also disturb their sleep. Then difficulty falling asleep or staying asleep or waking up too early due to the underlying health condition. Next, let's see the risk factors. Nearly everyone has occasional sleepless nights, but some are more prone to insomnia. So let's see who are they. First is if you're a woman. In women, in every stages, there will be change in the hormone, especially during the menstrual cycle and even during the menopause time, the women will be feeling sleeplessness. Especially during menopause, the night sweat and hot flashes often disrupt the sleep. Insomnia is also common during pregnancy. In pregnancy stage, it may be disturbed because maybe the woman will be feeling the baby movement, and even the big tummy will also feel a disturbance to sleep. And even the maturation level, the woman will be feeling for to go to the washroom for frequently. It also disturbs the sleep. And during the like menopause time, the estrogen level is less, and even at that time, the woman will be feeling hot flashes and mood swings. So in these cases also, woman is more prone for insomnia. Next is you are over 60. Once your age progress, our health condition is getting worse and the immunity level is also worse. And like because of the changes in the sleep pattern and health, it's more likely to have insomnia as you get older. You have mental health and physical health condition. Many issues that affect your mental and physical health can disrupt the sleep. As I already said, as you age progress, our health is becoming more weak. So at that time, there will be many disease condition, and at that time, it more prolonged to get sleeplessness and even mental issues like depression, anxiety. As a person get aged, there will be more prone for mood swings and all and short tempered. So that changes is there. So in this same like how mentally and physically changes, in this same like that there will be changing in the sleep pattern also. Next comes you are under a lot of stress. Being a stressful moment, it can cause short-term insomnia. One in case of stress and all, if it's for a short period, it's better you don't go for any medication. But if you're having a stress for prolonged period, better to take medicine for that. As a result, only nowadays people say they will not take the medicine for stress. Just simply they'll take the sleeping pills and then sleep. But it doesn't cause any change. So better go for the root cause for the stress and take the medicine and relieve the time. Next, you don't have a regular sleep schedule. So, for example, changing shift at work or traveling can disrupt your sleep. In some cases, like for those who are working, especially during weekdays, they'll have a proper sleep schedule. But during weekends, what they'll do is they'll sit up late night, late snacking, watching film and all. So then, as a result, they will be not be they'll be not feeling to sleep because the time has changed. So the next day morning, they'll be waking up late, and at that day itself, then they can't feel to sleep. They won't be feeling too sleepy because of the sudden change in time. So once if you're following a sleep schedule, just follow it for at least 21 days. If you want to feel sleepy, if you want to go for sleep, just try to sleep at like 7, 9 or 10 o'clock. Then continue this time for at least 21 days. Then only it will become you will be become habitual to it. So one day you will sleep at 9 o'clock, next day you will sleep at 10, or next day maybe 12. So in this way, you can't get a proper sleep pattern. So just follow a correct schedule and be consistent to it if you want to make it as a routine. Next, let's see what are the complications of insomnia. Sleep is important to your health as a healthy diet and regular physical activity. Whatever is keeping you from sleeping, insomnia can affect you mentally and physically. People with insomnia report a low quality of life compared with people who sleep well. So those who are having prolonged insomnia, in those cases, their lifespan itself is less compared to those who sleep well. Next, the complications of insomnia may include low performance in the job or at school. Suppose if you're having sleepless night, if you can't sleep properly, the next day you'll be feeling tired, fatigue, and not much refreshed. So in that day, you will be getting poor concentration, especially in students. Also, they can't perform good at school, and even those who are going for work, they can't perform good at their office. Even these people will be short tempered. They'll get angry soon because of the sleeplessness. Next, slow reaction time while driving and high risk of accidents. Those who are having prolonged sleeplessness because of the fatigueness or tiredness, there will be a chance of high risk of accidents too. Then mental health conditions such as depression, anxiety, or substance misuse. So in these cases, those people who are not sleeping well, they are more prone for psychological issues like depression. Then higher risk of worsening of long-term disease or conditions such as high blood pressure and heart disease. So we think that like for high blood pressure, if you're just reducing the salt intake, you will are higher. BP will be less, but it's not like just reducing on the diet, concentrating only on your diet, but also concentrate on your sleep, how well you're sleeping. Next, first, let's see what are the health benefits of a good sleep. Those who sleep well get sick less often because their immunity level is good compared to those who are not sleeping. Then stay healthy weight. Even because of your metabolism will be well, uh, we could able to maintain a healthy weight. Most of the obese people, we could see that the result of the obesity is not because of how much they are having the food, or maybe the food intake is small, but it's maybe due to stress, they will not sleep. So as a condition, they'll be putting weight and it may lead to obesity. Then improves your mood. If you're having a good sleep at night, the next day morning you'll be super energized and refreshed. So you'll be very energized to do your household chores or your office works or at school and all. Will be able to perform in a proper way. Now, lower your risk of chronic conditions like type 2 diabetes and high blood pressure. As I already said, those who are having good sleep, they are less prone to type 2 diabetes and high blood pressure. So, same like your diet and your mental state and your physical activity, sleep is also very important to be healthy. Next, improve your attention and memory is better to perform daily activities. For example, if you have those kids, those people or children who are going to school, they'll be able to perform well in their school because of good sleep. Now, let's see some of the steps that how we can prevent insomnia. Keep the time you go to bed and the time you wake up the same every day, including weekends. As I already said, if you're following a routine, just follow it every day. Not a timetable on weekend and not a timetable on weekdays. If you're following a sleep pattern, if you at least if you're say that if you'll go for sleep by 9 o'clock, continue it only even in weekend also. Don't make a change in weekend. Next, regular exercise can lead to a good night's sleep. Exercise is very good if for your sleep, but be sure that you are not going to do the exercise just an hour or half an hour before sleep. Always do exercise, even if you're going for a walking and all, go it early in the evening. If you're going at late night, walking or doing any physical more activities or like exercise or using treadmills and all, it will disturb your sleep. So it may lead to insomnia. So better do exercise or any other physical activity in the early evening. Then limit nap. Most of the people have the habit of taking naps, even multiple naps, especially after lunch and all people will go for naps. So limit the nap. It's better to stop it. Then limit or do not use caffeine, alcohol, and nicotine. The more use of coffee will disrupt your sleep. So if you're addicted to coffee and well, you can have coffee, but make sure you're having it in morning. Better to avoid it in evening and even at night. Same like that of alcohol and nicotine. Then do not eat large meals or drink lot of fluids before bed. In case of large meals and all, what's happening means your tummy will be full and you'll be not able to sleep. So always better to have your food just 3 hours before your bedtime. But always have a early dinner and even limit the use of fluid. Even drinking water and all just before bed, it's not recommended. If you want to have it, just have a few sips. Next is make your bedroom comfortable for sleep and you will only use it for sleep. As soon as we see our bedroom, we should be feeling it to sleep. It should be clean and tidy. Don't make your bedroom too much mess. And even what you can try is that use the bedroom only for sleeping. Don't do your office work, school studies, and all from bedroom. And don't keep your books also in the bedroom, especially for kids, for teenagers, those who are going to school and all. I'm telling, don't keep your books at your bed. Just just keep a particular room for studying and all. Don't study from your bedroom, because as soon as you see the school books and all, you will be feeling no to sleep. Next, create a relaxing bedtime ritual, calming activities such as taking a warm bath, reading, journaling, and listening to soft music. So, these relaxing activities like taking a shower, just take a warm shower before going to bed, and doing reading and journaling. In reading means I don't recommend like school books and all, just read any any positive thoughts books, and journaling like maybe you could do what are the good deeds you have done in the daily day. And even the journaling, like you can write, go for gratitude journal or affirmation journal, and listening to soft music. While listening to music, don't go for any rock music and all, just go for a soft music which can makes you feel sleepy. Or when you can hear some audios for like spiritual audios and all, even like nature sounds like rain sound and all, which create a calmness to your mind. In that way you can sleep. Next is create a sleep friendly environment. As I already said, the comfortable mattress, dark or quiet room. Even just keep, don't keep a bright light, don't want to switch on the light. Just keep your room light dim, or even you could use the light paints or pastel paints, which helps you to calm your mind and relax, and you can go for a good sleep. Next is one pattern for 3-1 technique for good sleep. That means just before 3 hours of bed, just stop eating. Step 2, 2 hours of bed, stop drinking. And 1 hour of bed, that is stop screen. So 3 hours of bed means stop eating, just have a early dinner, just 3 hours of before your sleep, and 2 hours before bed, stop drinking. Don't take water just before your bed. Next, 1 hour before bed, stop screen. Next, 3 hours before bed means stop eating. Avoid meals. Just can I pause for a while because Adhan is going on. I'll just pause for a while. Okay. Okay. So sorry for the inconvenience. Okay. Let's see the 3-2-1 technique for good sleep. Just 3 hours before bed, stop eating. 2 hours before bed, stop drinking, and 1 hour before bed, stop screen. 3 hours before bed, stop eating. Just have your dinner early as possible. If it's better, if you can have 3 or 4 hours before, you will be feeling properly digested, and you can go for a good sleep. Because as soon as you have your food and go for sleep, it can disrupt your sleep by causing indigestion and increasing your heart rate and interfere the ability to enter deep sleep. Next, 2 hours before bed, stop the fluid. Stop fluid intake 2 hours before bedtime. This can help your nighttime bathroom visit. It can reduce your nighttime washroom visit and sleep disturbances. Suppose if you feel thirsty and all, it's recommended to have few sips of water. You can keep water beside your bed, but don't have it more, because as soon as you drink water, you'll be feeling like some sort of disturbance to go washroom and all. So better stop it just 2 hours before bed. Next, 1 hour before bed, stop the screen. Avoid screens like phones, tablets, computers, and television that emit the blue light, which interfere with the production of melatonin, the hormone that regulates the sleep. As we discussed earlier, the blue light that emitting from the phone, it will interfere with the production of melatonin, and in that case, you'll be feeling sleeplessness. And not only those the screen what the light what is emitting, but also the news what you're seeing. So nowadays most of the people are more prone for the scrolling activities, so better stop the scrolling on YouTube and Instagram and all, especially during the night, because it will make your brain more fatigued. The more you scroll, the more energy is released from your brain, and to capture the news what you are. To feel sleep fast, that is 4-7-8 position like this. Then on a relaxation routine to signal the body that it's time for sleep. So what you can do is close your eyes, It's a deep breathing exercise. So in this case, just inhale for 4 seconds, hold your breath for 7 seconds and exhale for 8 seconds. So here what's happening means just inhale for 4 seconds, hold it for 7 seconds and exhale for 8 seconds. You can do this at least 5 to 10 times every day. It will make you feel sleepy. Next, listen to specific types of audios. Listening to specific type of audios before bed can greatly enhance your ability to relax and fall asleep. The best audios for sleeping type, it promote calmness and relaxation and a sense of peace. So let's see some which are the audios you could hear just to feel sleepy. First is nature sound. Sounds like rain, ocean waves, and forest sound. You could just play these sounds in your phone and just keep your phone under the cot. No need to watch the video, just hear the sound. Close your eyes, hear, listen to the sound, and gradually, if you when you're listening, it will make you feel sleepy. Then these sounds are often associated with relaxation and calm and helping reduce the stress level and creating a peaceful atmosphere to induce the sleep. Next is instrumental music, like soft, slow music without lyrics, including instrumental genres like classical. You could just play it in your phone. Make sure you don't go to watch the video. Just play the audio. Keep your phone under your coat and listen only to the sound. Close your eyes, listen to the sound, and gradually you will be feeling sleepy. While selecting the song or sound, just make sure it will make your calmness. Music with slow tempos can have a calming effect, reducing anxiety and signaling to your brain that it's time to wind down. Next, even you can go for guided medications or sleep stories. In early childhood, what we'll be more prone to get stories from our adults, even for parents or grandparents. And so now, so kids will know that it's time for to sleep by hearing their bedtime stories. These are spoken and word audios that lead you through relaxation techniques or tell a calming, immersive story. Even some apps like Calm or Headspace offer bedtime stories and meditation designed to guide you into sleep. Even it's better to go for a meditation just before bedtime. It will help you to keep your mind calm. Not only help to keep your mind calm, but also it helps to induce the sleep. These audios help to maintain the calm the mind and relax the body by focusing your attention and reducing racing thoughts. Now, listening to the affirmation audios. Listening to affirmation audios while sleeping can be a powerful tool for personal growth, relaxation, and a positive transformation. Because these affirmation, they always go for positive affirmation. These audios, not only the sound, it be soothing, but also it brings the influence in our subconscious mind. As a result, there will be a reprogramming happening in our mind and we'll be feeling a positive vibe for us. Next, here are some of the benefits of incorporating affirmations in our bedtime routine. First is improving the sleep quality. So as affirmation, positive affirmation, it will not only improve the sleep quality, but also there will be stress relief and manifestation. The calming nature of these audios can help to improve the quality of your sleep by creating a peaceful atmosphere. Then stress relief. Though if you're feeling tensed and all, if you're hearing a positive affirmation or a positive wording from someone, it brings a relaxing tone and peaceful to our mind. It helps to ease our stress and anxiety, promoting better sleep. Even the most important thing, apart from improving the sleep quality, it helps for manifestation. Listening to affirmation can help to manifest specific goals and desire by programming your mind. These affirmations can help for a manifestation and it helps to achieve our goals. So as I already said, it helps for the subconscious reprogramming. Affirmation can be absorbed by the subconscious mind because what happens means when you're going for feeling sleepy, or the conscious mind is not much awake. The subconscious mind will be more powerful during the sleepy time and all. So when you're going for positive affirmation, manifestation and all, it helps for to achieve our goals. Listening to affirmation can help manifest specific goals and desire by programming your mind to focus on achieving them. Next, tips of choosing the right audio. Not all type of audio work for everyone. Just check which type of audio is which is apt to you. Suppose the audio which is apt for one person will be different to the other one. So just check which audio is apt for you. So if you like one audio, just keep that audio every day. And be consistent in using it. Then keep it gentle. Sounds that are too loud or jarring can have the opposite effect. So always keep it in a mild voice. Don't increase the volume. Keep it in a mild voice. Then it will help you to feel sleepy. Next, now let's go to the homeopathic management for insomnia. How homeopathy address insomnia? As you all know, it's an individualized approach. Homeopathic treatment is based on personal overall health and individual experiences. Remedies are chosen according to the mental and emotional and physical symptoms that a person is facing. The first drug, what I recommend is Naxomica. Naxomica, it can be given to the indigestion related insomnia. Often recommend for people who suffer from insomnia due to overindulgence in food, alcohol, or caffeine, and even who are having a stressful lifestyle. This remedy relieves irritability, and most the person will be having sleeplessness at the early morning, like 3 a.m. Then, and the person will be having digestive troubles associated with overindulgence of food, tobacco, and even alcohol. The main symptom, wakefulness in the early hours of the morning, irritability and digestive disturbances. So those who are having any, due to any digestive disturbances, if they are having sleeplessness, you could go for Nexomica. Next is Lycopodium. People need this remedy often have no memory of dreams and often doubt that they have slept at all. Insomnia may set in primarily because of worry, lack of confidence. Those who are having lack of confidence can make them have to give, you can give lycopodium for them. Those who are having lack of confidence, even though they're having the ability, they'll feel some sort of lack of confidence in your mind. And even if those people who are more prone for gas troubles, because of that, they're feeling insomnia, you could just go for lycopodium. The person feels drowsy after meals but have trouble sleeping at bedtime. So in these cases, what we'll see means as soon as they had the food, they'll feel tired and drowsiness and all. But at night, they will be not feeling to sleep. They'll be not having better sleep. So better you could go for lycopodium in these cases. Ravenous hunger in the night that wakes a person up in another condition for lycopodium. Next is coffee cruda. That is a caffeine-induced insomnia. Indication useful for individuals who have difficulty falling asleep due to overactive mind, often triggered by excitement or excessive mental stimulation. Especially, for example, like if you are going for a trip or a travel next day morning, you'll be feeling like what? You'll be not feeling like to sleep. And suppose if it's just for a one day, it's okay. But at least for some people, if they're going for a trip and all, like at least 1 month and all, in that cases you could go for coffee period. They'll be waiting for those 1 month if already the date is fixed. And if not only the trip, maybe any events like marriage or any other events, because of those thoughts, they'll be feeling sleeplessness. Then symptoms, restlessness, racing thoughts, or sleeplessness after mental exertion. Next is Ignatia amara for emotional cause. Indication used when insomnia is caused by grief or emotional upset, mental stress, or especially after a loss. So in some cases, if there is a loss of our loved one, Ignatia. Next is the symptoms, restlessness, mood swings, and difficulty falling asleep after a traumatic event. Even after any accident and all, if you're facing like sleeplessness, you could go for Ignatia amara. Even arnica is also good in that condition. Next is sulfur for deep sleep disturbance. So in sulfur case, what is coming means if the person is facing any skin complaints because of that, like itching or any like a feeling of hot in the whole body, in that case, you could go for sulfur. Often used when insomnia is accompanied by heat sensation or irritation, typically in those who are prone to skin condition. This remedy may helpful for insomnia coming from itching or increased feeling of heat in bed. The person is irritable, anxious, and often feel a need to throw the covers off. So they don't like covering. Even they don't like to wrap their body with the bed sheet. So just kick off the bed sheet. They'll all be feeling all hot flashes. So in this case, you could go for sulfur. Lying awake between 3 and 5 a.m. A typical insomnia that develops because of lack of exercise also helped with sulfur. Symptoms: feeling restless and uncomfortable in bed, unable to sleep due to the physical discomfort. Maybe, as we said, mainly the skin complaints. So, in patients like those who are having psoriasis or any other skin condition, they will have sleepless night because of the itching and the hotness, the hot flushes that feel in their body. Now, chamomilla. Chamomilla for irritability in children and extreme irritability, and particularly when there is a desire for something but they are unable to relax. Restlessness and irritability often requiring attention, firm, soothing environment. Even chamomilla, you could to prescribe to kids those who are having bedwetting problem. Because of this bedwetting issues, they'll feel sleeplessness. So in this case, chamomilla is recommended. Next is arsenicum album for anxiety-related insomnia. This remedy is used for insomnia caused by anxiety, restlessness, and fear, particularly when the person feel uneasy about their health and environment. If they're having more fear about their health and fear of death, in these cases, you could go for arsenicum album. Because of fear of death, this person will not sleep. Their sleep is disturbed because of the prolonged fear of death. So in this case, arsenicum album is recommended. People who need this remedy are often anxious and compulsive about small details, about having trouble sleeping if they feel that everything is not in place. Suppose in this case, the person will feel like if the bedroom is not clean, if the bed sheet is not properly spread, this person will feeling uneasiness and discomfort. As a result, they'll feel sleeplessness. Sleep when it arrives, sorry. Sleep when it arrives can be anxious and disturbed with full of fear. Symptoms: restless, waking up frequently, feeling anxious about being alone and seeking warmth. Next is aconite. The main reason is fear. This remedy can be helpful if a person is panic with insomnia. Fear and agitation comes on suddenly when the person is drifting off to sleep. May even wake feeling insomnia because of fear. If anything happens on the daytime, if they fear of any like animals or watching a fearful movies, but especially in kids and all, if they watch any horror movies and all, just for one day it's okay. But if they prolong their feeling sleeplessness because of fear of the stories what they have watched, so in this case, you could go for aconite. Not only for children, for adults also. If the causative factor is fear, could go for aconite. Now, when to see a doctor? If insomnia makes it hard for you to do your daily activities, see your doctor or another primary care professional. Your doctor will search for the cause of your sleep problem and help to treat it. So if the symptom is persisting for a long period and it interfere with your daily activities, so at that time you could consult your doctor. Now, having a trouble falling asleep, take a time yourself for a good night's speech. Hmm? Take a moment to reflect on your day. Just close your eyes and just take a moment to reflect on your day and see what all good things happen and just congratulate yourself for the your accomplishment and talk to yourself that the next day will be a new beginning and you will be feeling super energized and be super excited what the next day will bring. Even you could go for visualization. Just close your eyes and visualize that you are going to have a good sleep. And next day morning, you will be waking up so refreshed, energized, and super excited. This simple positive act can bring your mind not only calmness, but also it helps you to take you to a slumber that is a sleepness. So this is the end of the session. I hope everyone liked this. Suppose if there is any mistake, I'm extremely sorry. I would rectify it next time. So that's all for today. Thank you so much.
Thank you, Dr. Sunira. It's really an excellent session. You covered almost all part of the insomnia. What are the causes behind the illness, this problem, and what are the classification and how we can manage. And not only that, you added some more thing to that, not only about homeopathic medicine, but also about the management, by the method, how to sleep, when to sleep, how the diet need to take, and when to take the diet, all those things. Anyway, it's a very fruitful session. Congratulations. We need such presentation in the future also. And those who are interested in talk in uh, participating in discussion may raise your hand so that we can allow you to unmute yourself and come. Yes. Yes, I shall begin the session with Dr. Manoj for the time being.
Thank you, Dr. Tanesh and Dr. Suneera. It's really happy to see these young persons or physicians really doing wonderful job. And moreover, I think the topic she mentioned about the condition associated sleeplessness. That is the character. That is a specialty homeopathy. Insomnia with gastric compliance taxonomic. That like presentation like that is the most helpful thing. Then again, it once again reiterates the importance of studying the textbook, the lectures on material medical rather than the therapeutic material medical. So that will definitely leading to this so-called holistic medicine. Then I think the potency is another important factor. Then the diet regimen is also an important factor. Then we can see the writings of Dr. Samuel Hellman, chronic disease, where he mentioned all these things. He strongly advocates that playing of cards should not be allowed. But you can have the music or you can dance. All these things will help, especially in chronic disease, but it should interdict the playing of cards. So we must go through, along with the material medical study, the homeopathic philosophy is an important factor that will help, that will further enhance your knowledge. Anyway, congratulations and come again your this platform, not only for presentation, but also listener. Thank you.
Yes, it's the time for that's a very good thing. But the thing is that most of the people coming over here and making presentation, and they will leave the session. But it is not a good sign. Definitely, those who want to study homeopathy can watch our sessions every day. Even if you are not able to attend the session, then you can watch at least the. You can subscribe and share the videos of the same. Please go to the previous videos also. Yes, Harihan sir is there. Definitely, sir is a person who can talk something more on that subject. Okay.
Okay. Okay. Can you hear me?
Yes, sir.
Wonderful. Very good. Very good presentation. Really, she deserves appreciation. See, I like to say one or two things. Opium, one of the best medicine for sleeplessness. The condition is that sleepy but cannot sleep. That is the peculiarity of the opium. I think she has not mentioned that opium. Is it so?
Yes, she forget. No.
She has not mentioned. But another thing I like to say, see, next, satisfactoria, one of the best medicine. If that person has indignation and mortification, if that disturb the sleep, the sleep, that satisfactoria is one of the best medicine. The another thing I like to convey is that back flower remedy. In back flower remedy, one of the best medicine I have noted is white chestnut. If you continuously give white chestnut along with the homeopathic medicine, really, I'm sure this sleeplessness will improve and the patient will get sound sleep. I like to say, you please practice this the bowel noso. I mean, not bowel noso, back flower remedies along with this. Anyway, I am congratulating you. Come again in our platform. Okay, thank you very much.
Thank you, Dr. Harihan sir, for adding something more to this presentation. Really, Dr. Jumana is a very young, dynamic person who can definitely study all those things, and she will come up with one of the leading practitioners of homeopathy in the coming years if she does these things in a regular way and continue to practice in Qatar, because there's a place where homeopathy is going to be one of the treatment method in the coming days, I think. I am invited Dr. Abdul Salam, Sri Abdul Salam, Mr. Abdul Salam, to say a few something more about the Qatar homeopathy, condition of Qatar in homeopathy. Please unmute, sir.
Thank you, Dr. Dhanesha. Very nice presentation of Dr. Suneera. Sorry, you said Dr. Jumana. Okay.
What is the present condition of homeopathy in Qatar? That's what we want to know about.
Present condition, we can
Whether it is allowed to practice homeopathy there or
just now. Okay, now one doctor got a license and he is practicing also.
okay.
But the two doctors done their data flow and rest doctors completing their data flow soon. Okay.
Okay.
And we can make a session, special session with the Dr. Fahid.
Yes, yes, Doctor. Yes,
Dr. Fahid, who got the license. We can put a section, another section. Okay.
Definitely, that's good.
Okay.
Now, Dr. Suneera, you can make your statement here about the comments made by some of our senior doctors here. Dr. Suneera, where are you?
Oh, okay, I'm here. I just went for a short refreshment. Okay, thank you so much. I missed some of the drugs. I'm really sorry for that, but it's good that you have rectified my mistake. So I'm so happy that I got this opportunity. If any, now I'm planning to commit again in this platform. This is my first webinar. Now, after a break only, I'm just taking some sessions and even facing camera and taking the videos and all. So now I think it's a good start for me in this 2025. Once of all, thank you so much.
Yes, that's a very good statement from your part. And definitely we will be here to support you as well as the junior doctors, because just down there was a discussion going on in the Hindi session that most of the junior doctors are nowadays not practicing. They are simply finding some other business or job. It is not I must say that all of us have struggles in the beginning part. Even Dr. Kent has suffered a lot during his early part of his career. But later on, when you become a very good, gradually you can grow and win the heart of the people, and thereby you can become a very eminent personality in homeopathic fraternity. That's why we can see lot of dynamic doctors just having 13, 15 to 20 years of practice are doing excellent job in some other part of India also, not only in India but in Kerala itself. We can see a lot of young dynamic, but there are a lot of struggles going on when you start. Particularly ladies may suffer a lot in the beginning, or because they may have to marry, then they have to settle down with the family, and then it may take some time, and then gradually you can come into the picture, and then you can start practicing and establishing yourself. If the husband is a person who really loves homeopathy, will definitely push you into the practice, and thereby you will be not only a breadwinner for your family, but a very eminent personality for the society itself. That's what I would like to add to the young dynamic doctors. Anyway, Harihan sir, do you want to say anything? I invite Sunila doctor to say a few words on this just before closing.
Myself.
Yes, sir.
Okay.
We are
It was
one of
very
the
nice session. was a very nice session. She covered all the topics. Even though she's missing some medicines, it's not a uh, it's justified. So we can add any medicine in homeopathy to this picture. The homeopathy, we can take the case in detail and we can give any medicine for this insomnia. But the Harihans are added very good medicines. That's also very medicines which are giving good results in insomnia. That the Staphysagria, opium, etc. It's very nice session. Congrats, Suneera.
Yes.
Thank you. Yes, thank you.
Caliphos can also be added to the list again.
Yes, Caliphos.
And now it is the time for our veteran, Dr. Amparesa sir, to say a few words.
Thank you, Dr. Dhanesh ji and Dr. Manoj ji and हमारे experience holder physician Dr. Hariharan sir and everyone. Namaskar. Good evening. Very nice presentation. Congratulations of Suneera Javed. Excellent session. Insomnia cause and effect, and many kinds of deals medicine. Opium is a very good remedy, advised Dr. Hariharan sir. And in this position, maintenance cause of disease, insomnia, Natsunka is the best medicine. And so very thanks and congratulations, Dr. Suneera Javed.
Okay, sir. Thank you very much, sir.
Excellent session. Thank you.
And now I invite Dr. Jumana Hazin to say vote of thanks to the session.
Yeah, hello everyone. I'm really proud of Dr. Suneera for delivering such an informative and engaging webinar session on the relevant topic insomnia. And as a batchmate, and more importantly, a dear friend, it's been an absolute pleasure to watch you grow and to share your knowledge with all of us. And your presentation was both enlightening and incredibly relatable too. Thank you once again for sharing your insights and your enhancing our understanding regarding homeopathic approaches to insomnia. We look forward to more such informative sessions in the future. Keep shining, Dr. Suneera. And thank you, IFPH team, Dr. Dhanesh, Abdul Salam sir, and all the participants who joined us in this webinar session. Thank you.
Thank you, Dr. Jumana Hussain and Dr. Suneera Javed, and those who attend the session this evening for such a wonderful session. And with that, we come to the end of the day. So we have a presentation from Dr. Nirmal Chandra Bole, who is the principal and HOD of the Department of Practice of Medicine, Jim's Homeopathic Medical College Hospital tomorrow, and we'll be talking about common respiratory disorders and its homeopathic management. So another big session is coming on tomorrow. Hope all of you will be with us. You can all join the session with the same link that we used today. Thank you all. Good night. With that, we come to the end of the day, 1,800. Sorry, 1,585. It's up to Dr. Manoj to be in the Malayalam session.